What makes the impact of this coronavirus particularly significant is that it is highly infectious. For example, it spreads much more quickly than the coronavirus that causes SARS or MERS. It seems that young children are not infected with the virus as frequently as the rest of the population. However, above the age of around 10 years old, it appears that the virus does not discriminate against age. This means that many people, vulnerable or not, are susceptible to developing COVID-19. For the virus to spread to a new person, it must first be shed from the body of the infected person. It can do this by droplets released when they cough or sneeze. These viral droplets must then travel to the respiratory tract of the new person or people. This route of transmission is the main way that scientists believe that the new coronavirus is spreading. However, they do also acknowledge that there are many other routes that it can take. For example, an infected person could release droplets onto a hard surface which is then touched by another, and this person can then touch their face. Also, there is evidence to suggest that the virus could even be airborne. Therefore, it could be expelled when a person breathes or talks and linger in the air for up to 3 hours. It is believed, but not yet conclusively proven, that asymptomatic and pre-symptomatic people are spreading the virus. This could partly explain the rapid spread we have seen, since it means that people who feel well or seem well will be unknowingly transmitting the virus to others and their surroundings. The more we uncover, the more it becomes clear that there are many ways the new virus can spread. However, it is important to realize that not all situations pose the same risk of infection. For example, evidence from this and previous coronavirus outbreaks show that it is predominantly healthcare workers who catch the virus, and that other workers, for example retail or office, are much less likely to get sick. Close contact with sick patients is thought to be the main reason for this, and we can use this type of data to exercise judgment about our own daily routines. For example, you will be at a very minimal risk in a shop if you are keeping 2-meter distances from people you don't live with. However, if you are in a large crowded bar where no one is wearing face coverings or abiding by distancing rules, then the risk of transmission is much higher. Understanding how the virus spreads and exercising good judgment will protect yourself and others and drastically reduce the chance that you will catch or spread the virus that causes COVID-19.